It's hard to believe it's been 5 years, but it has been 5 years since the pandemic started. And since then, long COVID is really still impacting millions of Americans. New cases are actually still popping up.
And there's still no cure for it. That's the bizarre thing. Doctors are getting a better idea of who's likely to get long COVID, though. NBC5's Patrick Fazio tells us about a suburban hospital that right now is participating in nationwide clinical trials, trying to find a cure.
You have symptoms that you would normally have, like sweating, like heavy breathing, like fatigue, dizziness, things like weakness.
Patty Jones of Evanston says she has trouble walking without losing her breath ever since she got COVID in 2022.
I used to walk 3 miles a day. I can't. I used to swim 3 times a week. I can't do any of that at all. Walking in here from the parking lot got my breath going.
Patty was diagnosed with long COVID more than 2 years ago, and she's developed other symptoms.
I can't really go out too much. I can't go to a restaurant that's noisy. It brings on anxiety, and I was never like that, never.
She's part of a long COVID study at Endeavor Health with about 70 patients. It's called Recover COVID, and it's funded by the National Institutes of Health.
The younger people and the older people don't often have pre-existing conditions that would explain why they have long COVID.
Clinical research nurse Melissa Morton says the youngest patient in the study is a 23-year-old who's had long COVID since 2021.
And when she goes to stand, gets dizzy, lightheaded, nauseated, extreme fatigue, and cannot function the way she used to.
There's over 200 different types of signs and symptoms that can result in you being defined as having long COVID.
Dr. Nirav Shah is leading the trials.
People are still getting diagnosed with long COVID. People are still getting diagnosed with severe COVID.
Part of the research published last month found just how widespread long COVID is.
Between 10 and 20% of people who have COVID end up getting long COVID. This is in the millions, and it's a significant burden.
Just going to take a listen.
In the meantime, doctors recommend everyone stay up to date on COVID vaccinations.
People who get the vaccine tend to have less long COVID, and that's some of the data that we've found. The more times you get COVID, the more likely you are to get long COVID.
Patients like Patty Jones are participating in the study to give others hope for the future.
I'm almost 72. At this point, there's no cure, so it's probably for the rest of my life.
Patrick Fazio, NBC5 News.